What is going on, guys? Welcome back to my channel. If you are new here, then I'd like to take the time to wish you the warmest of welcomes and hope that's the first of many visits that you make. My name is Matticus and I am a physiotherapist working for the NHS in London. Today I'm going to talk about rehabilitation after a patella dislocation. If you're not particularly interested in the sciencey part and you want to skip straight to the rehab and the exercises, then I'm going to leave a timestamp in the description below. As always, it might be beneficial for you to understand what exactly has happened with a patella dislocation so that you can rehabilitate your injury better. So what is a patella dislocation? Well, usually at the end of your thigh bone or femoral condyle, you have this little groove called the trochlear groove. A dislocation occurs when there's a shift laterally, so away from, if this is the midline of your body, laterally is away from the midline of your body. So the kneecap is dislodged from the groove and it will stick out laterally, and it's pretty obvious that you've dislocated your kneecap. It usually happens in athletes and is more common in women in the second decade of life. Usually it is a non-contact injury, so signs and symptoms that you have dislocated your kneecap or your patella. It's kind of obvious really. Your kneecap will be sticking out to the side, it will be very painful, you might have swelling, you probably won't be able to walk, you won't be able to move or bend your knee. It might feel unstable and it might lock, and what I mean by lock is it gets stuck in one position after you move it once, and it just sort of stays in this position and it's very painful to move. So the first stage is controlling pain and inflammation. Now if you have dislocated your patella or your kneecap, if you're very lucky it might slot back into place, or if not you might have to call the ambulance and paramedics will arrive to pop your knee back into place, which is very, very painful. Usually you're then going to hospital and you'll probably be put in a cast or some sort of brace that you just can't bend your knee, and you'll be kept in this brace for up to 6 weeks. This stage of rehabilitation involves simply taking painkillers that your doctor has prescribed and keeping your knee elevated and minimizing any potential further damage by just not moving your knee that much. You basically have no choice but to immobilize your knee. Follow the P.O.L.I.C.E Principle, protect, optimal loading, ice compression, elevation. As I said, your knee will be immobilized for up to 6 weeks, and this is due to the fact that this is the length of time that your ligaments and your tendons and all those soft tissues around your knee will take to heal. The next stage of rehabilitation is increasing range of motion, so you can begin to do some gentle exercises and stretches and mobilizations. The first thing that you can do is called an isometric knee hold or isometric knee extension. You can place a towel under your knee and you want to essentially contract your quads so that you are extending your leg and straightening your leg at the knee joint. So you want to do this for 3 sets of 10 repetitions, but for each repetition you want to hold it for 5 seconds. The next thing that you can do is to mobilize your kneecap. So when you sit in a relaxed position, your kneecap will be freely movable, and what you want to do is gently glide your kneecap towards your midline and do this for 3 sets of 20 to 30 repetitions. This should not be painful. And of course you have quad stretch and a hamstring stretch. You can do these both for 3 sets of 30 seconds daily. So all these exercises you want to do daily. The next stage of rehabilitation is strengthening. We want to load the knee joint, we want to get the muscles firing, we want to get blood to the area, as well as strengthening the muscles around the knee. You're decreasing the likelihood of a future dislocation, of a future injury. So you can do a straight leg raise when you're sitting on the ground or in a chair or lying on the floor. You can also do a side lying leg raise. You can also do bodyweight squats. They're a great exercise to do as they're not particularly challenging and you can do them anywhere. So for these exercises you want to do 3 sets of 8 to 12 repetitions, and you want to try and do this every day. If it's a bit difficult, then every other day. The final strengthening exercise that you can do is called step-ups on the stairs. So as you can see in the video, I've got 1 foot on the step above and 1 foot on the step below. You can do this on the bottom step, and you want to essentially just do a step up of 3 seconds on the way down and then extend your leg and push up so that you're standing up again. This one is 3 sets of 10 to 12 repetitions. Alternatively, if you find it hard to get 10 to 12 repetitions, then do 3 sets of as many as you can possibly do in 20 to 30 seconds. So the next stage of rehabilitation is proprioception, so restoring that joint position sense When you have dislocated your patella and have been in a brace or a cast for 6 weeks plus, you would have lost some of that proprioception. So some of your mechanoreceptors are not going to be able to tell where your knee joint is in space. And by working on proprioception, we can increase this joint position sense and decrease the likelihood of another dislocation of the kneecap. So the first exercise you can do is single leg stands. When that becomes a bit too easy, you can progress to single leg squats and then full-blown pistol squats as the most advanced variation of the exercise. Now for this, you want to do it every day if possible, 3 sets of 8 to 12 repetitions. If you're doing the single leg stands at the start, you want to do 3 sets of 20 to 30 seconds balancing on that leg. The next exercise you can do is called the aeroplane exercise. So this is really good at working your hamstring and also working on your balance. So you want to have your arms out to the side like an aeroplane. You want to keep the leg that you're balancing on straight or as straight as possible, and you want your other leg off the ground, lifting it up behind you. Keep yourself in a straight line, so you're going up and down in a straight line, and you don't want to deviate from this, and this is really going to work your hamstrings and your balance. 3 sets of 12 to 15 repetitions. The last thing that you can do is the yoga ball on the wall exercise. So you want to lie on the floor and have your feet at a 90-degree angle to the wall, and then you want to make sure you have enough space to put a yoga ball or one of those Pilates balls in between your foot and the wall, and then you want to slide the ball up and down the wall in various different positions, and you want to do this for 3 sets of 20 to 30 seconds. When this becomes too easy, you can shut your eyes and you can use a smaller ball, things like that. That is the last proprioceptive exercise. The final stage of rehabilitation is known as sport-specific rehabilitation, or getting back to normal, getting back to what you were doing pre-injury. The first thing to do is to make sure to warm up and mobilize your joints right before any strenuous activity. The second thing is to make gradual progress getting back to what you were doing. If you were running 10 kilometers a day, you don't want to go straight back into running 10 kilometers a day. You want to build up 1 kilometer, 2 kilometers, 3 kilometers over the course of a few weeks until you reach that 10 kilometers that you were doing before. So the trick here is to carry on doing those stages of rehab, stages 2, 3 and 4, even after your injury is healed, especially stage 4, which is the proprioception, because by doing it this way, you're going to ensure that you reduce the likelihood of you dislocating your kneecap again. That about concludes this video on kneecap dislocation or patella dislocation rehabilitation. If you enjoyed this video, if you found it helpful, then please give this video a like, as it really does help the channel out. If you would like to see more videos like this, then why not click on the subscribe button down below and comment to let me know what other types of videos you want to see, and I will try my best to make that happen. Until next time, see you guys. Peace.